This assessment was administered by occupational therapy students Katie Beth Drew and Dixie Alley. We did the Alberta Infant Motor Scale. Its purpose is to measure the motor development of infants as well as screen for developmental delays they could possibly have. It can also be used to monitor change over time. The test should take around 20 to 30 minutes to administer. A healthcare provider with expertise in infant motor development must administer the AIMS. The assessment is an observation of natural as well as spontaneous movement in 4 different positions of prone, supine, sitting, and standing. Our client was KA. She is a female who is 1 year, 4 months, and 36 days old. We performed the assessment at her home with her mother present. We began the assessment in the sitting position. Here we see her sitting without arm support. We also see her weight shifting into various directions. We see her arms move away from her body to play with the provided toy, and we also see her rotating unsupported as well. From the observed movements, we obtained the scoring window for the sitting position of the least mature and most mature actions that is seen here on the score sheet. Next, we place KA in the supine position with her hands beside her side, but her head is in midline. She then transitions with her chin tucked to bring her hands to midline. In this next clip, we can see her bring her knees to her hands, and we also can see her bringing her feet to her hands as well. Here we are trying to facilitate her rolling from supine to the prone position, but she was unsuccessful. For the scoring, we again use the least mature skill observed to the most mature. The next position we placed her in is prone. Here she began with her elbows in front of her shoulders. She then can be seen with her arms extended and an active chin tuck with her chest elevated. She reaches from an active arm support as well in the prone position. She then pivoted from side to side while reaching behind her for a toy in the prone position. Her scoring in the prone position is again starting with the least mature skill we observed to the most mature. Here she can be observed being unsuccessful at pulling to stand. We placed the toy on a chair in order to encourage her to try, and as you can see, she was able to reach up and grab the toy, but did not have any motivation to pull to stand. Here, her mom is having to help her stand, so she can be seen having to stand with supports, and her knees and hips are flexing intermittently. Due to her inability to crawl or walk, this is her observed method of getting around her home and daycare room. It can also be observed as scooting.
Once we have obtained scoring windows for all 4 positions, we can then determine subscores for each of them. We will use the supine position as our example of the scoring procedure. The least mature position observed in supine was head in midline. The most mature position observed was bringing hands to her feet. Once these are determined, we then will go through each position within the scoring window and mark whether the position was observed or not observed. To get the sub-score for the sitting position, we then allot 1 point for every position below the least mature in the scoring window, and allot 1 point for every observed position within the scoring window. We then simply add the points together. Once the sub-scores are found for each of the 4 positions, the scores are then added together to determine the total score for the assessment. We then will find the infant's percentile rank by plotting their total score and their age on the scoring graph provided within the assessment. Based on KA's sub-scores, she scored a total of 26 for the overall assessment. This places her below the 5th percentile for her age range. These results point out the presence of developmental delays in KA.